Hello, my name is Maggie Riley. I am a family physician and I'm the medical director of the Adolescent Health Initiative. I'm also a parent of 3 kids. We had AHI's Teen Advisory Council make a video describing how adolescents can advocate for themselves within a healthcare setting. This video is a companion piece describing how parents can intentionally empower their kids to be more independent when they're at the doctor's office. We'll also hear from teens who had some great ideas on how they can take the lead and gain independence in a healthcare setting. Why is it important to give your adolescent child some autonomy at the doctor's office? What's the value in that?
Well, it's part of, evolving into an adult, and that interaction with the doctor and feeling comfortable too. It's all part of, it's going to improve their health care.
I think you're absolutely right about that.
The more you talk to the doctor, the better care you're going to receive.
Yeah, because what we do as parents, I think a lot of times, is prepare them in all different areas to take care of the academic needs, the financial needs. But we really don't stress that health care thing. And that's just as important to me as anything else.
I agree.
I think that parents don't recognize right away that going to the doctor is a real learning opportunity for some teens. I want my parents to still kind of teach me how to do certain things, like how to schedule appointments, but let me have the freedom to do this kind of thing on my own.
Okay, so tell us about a time when you've seen your child be more independent in a healthcare setting.
In my case, I have a child who has peanut and tree nut allergies and asthma. My older son had health issues as well, and we kind of just took care of him and didn't give him a lot of ways to interact with the healthcare system. I just did all of it. I think with what my younger one has, he has to be able to advocate for himself. He deals a lot with the healthcare system and has to speak for himself because we can't speak for what he's feeling.
Starting at age 12, the recommendation is that the doctor spends time alone with the child at least once a year. And part of that is because starting at age 12, you can access some services confidentially without your parents' knowledge or consent. But most of it really at 12, 13, 14 is really to let the child have some chance to take ownership over their health and share their information, share their view of what's happening with them. So has anybody had that time where the doctor asked you to step out, and how did that feel for the first time?
I haven't. The closest I got was even better actually, because there was one accident my 13-year-old had, and we had to go to urgent care and get stitches. And in that case, it wasn't something where I was asked to leave. He said, "I got this." Aww. So he went in and took care of that with the doctor, and I'm happy with that. I think that is going to lay the groundwork for when something more important involving health happens.
There's some things that a teenager just doesn't feel comfortable talking about with their parents or in front of their parents, and confidentiality also shows me that I can trust my doctor to speak to them about what's going on with me.
It can be difficult for parents to step out of the room and let their teens take ownership over their health and have an independent conversation with the doctor. However, this is really a crucial part of growing up and allowing teens to thrive once they leave the house and are on their own. So starting at age 11 or 12, it's really appropriate to let your teen or your preteen tell their story to the doctor and start giving them information about their own medical history and their family history as well. At 14, 15, 16, it's a great opportunity to have the teen check in on their own at the doctor's office. Finally, once they're able to drive, it's a really good experience to have them go pick up a prescription on their own. They can call and make their own appointment. Because starting at 18, hopefully they gain independence in some way, and then they'll really be on their own in a healthcare setting and need to feel confident in navigating those kind of systems.
If I had to manage my own appointment right now, or if I had to schedule a general checkup, I would be really scared to do it, but definitely I would kind of learn and try to make myself be independent as well, because I know that it'll help me in the future.
I think the biggest piece is so that they can ask questions for themselves and not listen to friends. When my daughter was younger, I really encouraged it because I wanted to ensure that she would build that relationship, so that, because I knew at some point they would be asking me to leave the room and they would be having these one-on-one conversations, but I wanted her to feel comfortable with a medical provider. But also know if you have a medical provider and they're not fitting the bill, you can recognize it.
Yes.
And you can recognize it too. It's like, oh no, this isn't, what it should be. You can really recognize if it's off. So
I want to piggyback on what everybody else has been saying about how we have to prepare our kids to understand and appreciate and utilize the resources that they have, building that village around them. and not only building it around them, but like teaching them how to, when they go from adolescence to young adult, how to extend that village to other resources. And I think that's key, and I think if we continue to do that, they'll be all right.
We all want our children to grow into healthy and happy adults. Hopefully, this conversation will help you navigate one small piece in that successful transition.